this is Boyeon Kim, Head of Clinical Research of Korea Tooth Bank. In our last lecture number 8, we introduced surgical procedure of mandibular ridge split using AutoBT added with bone morphogenic protein and its successful result. Today, I will also introduce a surgical procedure and long-term clinical outcome using AutoBT.BMP in the maxillary anterior region. This picture is recombinant human bone morphogenic protein, which got approved from US FDA last 2007 and have been used for ridge augmentation for the defect related to the extraction socket and sinus augmentation. How to use this absorbable collagen sponge is that fine BMP powder is diluted in the sterilized saline and absorbable collagen sponge is soaked with this solution. And this procedure is done patient's chair side just before the procedure. But AutoBT.BMP of Korea Tooth Bank, we call this as dentin composites or DDM with RHBMP, is an integrated dentin that each dentin particle is coated with BMP. Consequently, it has the same appearance as the existing dentin powder and convenient to use as well. In addition, when using RHBMP soaked in absorbable collagen sponge, side effect of absorbable collagen sponge caused by overdose and bulk leakage might be the major complications and concerns. On the contrary, dentin composites reduce the dose rate of BMP to about 1/7, but it still retains the bone induction capacity while reduces its side effects. This is the picture showing the loading of BMP into dentin introduced last time. Left picture shows processed dentin and bone having same components, and dentin composites have 3 types of BMP, 2 exogenous BMP, and 1 endogenous BMP shown on the right figure. These are the research papers related to BMP, which is approved for clinical safety and effectiveness. Especially, it was a great honor that histological feature of dentin reinforced with BMP was selected as the cover art in the issue of Tissue Engineering on June 2020. Today's case is maxillary right anterior GBR procedure introduced in Chapter 3 of book An Updated Dental Implantology and Biomaterial published in 2019. Subluxated anterior tooth have been left unattended for about 3 years. After tooth extraction, implant was placed and about 5 to 6 implant pitches were exposed due to labial plate dehiscence. After 10 days, open flap to confirm the labial defect and expose the implant pitch. GBR with moldable AutoBT.BMP done on the defect and suture. Even without using the membrane, you can see dentin powder mixed well with the patient's blood. Due to the sudden departure schedule of the patient, second surgery was performed in 5 weeks. We had no choice but to do second surgery at 5 weeks operation. Though in 5 weeks, we were able to see the new bone that filled the defect. Let's look at the healing process on the X-ray. This shows the maxillary right centered incisor subluxated and left for several years. After being left for several years, the tooth was extracted and implant placed. This is the margin of labial defect. Left shows repaired labial defect over cortical bone margin, and after 15 months in the middle, it is remodeled forming the shape and volume of the alveolar bone. It shows the completed cortical bone after 34 months on the right side. In particular, you can see healthy cortical bone well formed around the neck of the implant. For me, average of 12 months after completion of the final prosthesis, if a sound corticocancellous bone is formed around the neck of the implant, it is judged as a successful clinical procedure. The left side shows gingival condition before extraction, and the picture on the right is 5 months after surgery. The 3D follow-up picture will be the message of the day. The left side of the CBCT shows GBR with AutoBT.BMP after implant placement. Next, you can check the new bone that grows up to the neck of the implant from the remaining labial cortical bone margin after 15 months of GBR. About 5 years, you can see the completely regenerated bone in the labial defect, that is, the sound corticocancellous bone. Altogether, AutoBT.BMP has potential remodeling capacity under prosthetic loading as well as powerful osteoinductive materials at early postoperative stage. The case introduced so far can be said to be clinically successful because well-developed corticocancellous bone around the implant neck can be observed in early stage and sustained during the long-term follow-up period as well. Of course, since this is only one case, I will provide the papers in subtitles to further check the relevant scientific evidence. First, Journal of Heart Tissue Biology as experimental evidence, and same Journal of Heart Tissue Biology for in vivo study, and Clinical Implant for clinical data. For further information, confirm the evidence clearly through the related literature. Thank you for your kind attention.